USMLE style question, Goodpasture syndrome. A 25-year-old man presents to the emergency department with hemoptysis, fatigue, and dark-colored urine. He reports a 2-week history of malaise, low-grade fever, and progressive shortness of breath. He has no significant past medical history and does not smoke. Physical examination reveals mild tachypnea and bibacillar crackles on lung auscultation. Laboratory studies show hemoglobin 9.8D low, creatinine 3.2 milligrams per kilo elevated. Urinalysis, RBC casts, mild proteinuria. Chest X-ray, bilateral pulmonary infiltrates. Serology, positive anti-GBM antibodies. Which of the following best describes the pathophysiologic mechanism underlying this patient's condition? A. Immune complex deposition in the glomerular basement membrane. B. T-cell-mediated destruction of alveolar and glomerular capillaries. C. Autoantibodies against type 4 collagen in the basement membrane. D. Granulomatous inflammation of the respiratory tract and kidneys. E. IgA deposition in the mesangium. Answer and explanation C. Autoantibodies against type 4 collagen in the basement membrane. This patient has Goodpasture syndrome, a rare autoimmune disease characterized by pulmonary hemorrhage, hemoptysis, bilateral infiltrates, rapidly progressive glomerulonephritis, RPGN, hematuria, RBC casts, proteinuria, acute kidney injury, antiglomerular basement membrane, anti-GBM antibodies, which target type 4 collagen in the glomerular and alveolar basement membranes. Why not the other choices? Choice A, immune complex deposition in the GBM, seen in lupus nephritis or post-streptococcal glomerulonephritis, PSGN, which involve granular immune complex deposits, not linear deposition as seen in Goodpasture syndrome. Choice B, T-cell-mediated destruction. This occurs in acute cellular rejection of transplanted organs, but Goodpasture syndrome is antibody-mediated. Choice D, granulomatous inflammation of the respiratory tract and kidneys. Describes granulomatosis with polyangiitis Wegener's, which presents with C and K positivity and nasal involvement, sinusitis, saddle nose deformity, which are absent here. Choice E, IgA deposition in the mesangium, seen in IgA nephropathy, Berger disease, which presents with episodic hematuria following upper respiratory infections, but without pulmonary involvement. Key takeaways. Goodpasture syndrome's anti-GBM antibodies against type 4 collagen causes pulmonary renal syndrome, hemoptysis plus RPGN, linear IgG deposits on immunofluorescence of renal biopsy, treated with plasmapheresis, corticosteroids, and immunosuppressants.